It is a huge honor today to be interviewing a real role model of mine, Eric Jackson. I feel like we have so much in common. We're both DDS. We're both masters in the Academy of General Dentistry. We both have our fellowship in International Congress Oral Implantology, and on and on and on and on. And I have really gone to school following you on social media too. I mean, you were the first person I know who you just did it all right. It was your social media posts are educating and informative. I always want to read them, and I can just imagine how your patients wondering. How are you doing today?
I'm doing fantastic. Thank you. Thank you for the kind words. That's fantastic. I mean, coming from someone like yourself with admittedly some of the top posts around, means a lot to me. Thank you.
Oh, hey. And so I want to start off. I mean, there's so many things I could talk to you about. I mean, you're a master clinician. You're an implantologist. You're a successful businessman. You're the top 0.01% social media marketing that I've ever seen, and I've been on social media pretty big time since 1998. So did your dad ever forgive you for not being an orthodontist?
Yeah, no, but my father he is fantastic, and he still teaches down at the orthodontic department at UIC, and never once did he ever push me towards it. In school, I was always drawn to the exercises where we basically had a treatment plan, and that's kind of what kind of convinced me that I belong more in general dentistry. Kind of then was the genesis towards all the different multidisciplinary approach and the AGD fellowship classes and things like that. I enjoy sitting down with somebody fresh and deciphering what they need. Maybe it's one filling, maybe it's 100 million different things. But because there's so many, for lack of a better term, bullets in my gun, right? In our office, we can do almost 80% of all dental procedures. We still refer out plenty. But the nice part is we have deep, intimate knowledge of everything, all the different disciplines, and that really transfers into the initial treatment plan. Because, as always, the old cliche, the general dentist, whether he or she's doing the actual treatment or not, is always the quarterback of the case. And you're able to then direct where needed and, more importantly, advocate for the patient. You're their home dentist. You need to be able to translate the dentalese into layman. And it works out really nicely that way.
Well, maybe this would be a great time to ask you one of the biggest controversies among practice management consultants is, the patient calls up and the number one reason they call a dental office that they want a cleaning. And so if a new patient calls up you and you're this multidisciplinary person and says, I want a new patient cleaning, how do you handle that?
The answer is essentially I've got our certain ways. I always like sitting down for a comprehensive exam first. We can do, if necessary, obviously a quick exam, but that won't get you into the cleaning department. It won't get you into the hygiene department. And just simple patient education. It's the fact that if you're blowing people's mind when you tell them, well, we need to figure out what kind of cleaning you need. What do you mean there's multiple types of cleanings? I didn't know there's multiple types of cleanings. And you go through the different types of cleanings, different levels of invasiveness, etc. And just that alone, just being able to sit down and explain that one fact to them, let alone the rest of it. Like my comprehensive exams are about 90 minutes long.
Can you go over that, the specifics of it? I bet a lot of people would want to hear that. Sure. What is the new patient? If I called up your office and I said, I want to see Eric because that's the same name as my first son, Eric Farran. Yep. And so I chose you just on your name, Eric. What happened? So you walk us through that. You scheduled me for 90 minutes and how does that actually work? What happens first in the order?
Of course, they come in the office. We sit down, actually in this room where I'm at, my consultation room, and myself, the patient, and typically my assistant, we just sit down and we kind of just get to know each other a little bit. I need to know where you want me to take you, what your major goals are, your past experiences, pros and cons to those, your likes, dislikes about the past experiences. So that way we can hopefully, get a glimpse of you in a snapshot in time. We got to be able to build. I always say at that appointment, we're not just taking one little look at you today. We're putting the very first brick of a 40-year wall, and we're going to be building a big giant house. And this is the cornerstone appointment. We need to make sure we're very thorough, and all things come from today. So then after that, we sit down for a good, 10, 15, 20 minutes or longer for whatever it takes. That's why we like to have that much time. We'll go to the operatory, of course, radiographs, photographs, and a big thing for me, I'm very interactive with the patients. I think it's very important to be that way because I'm a visual learner. So I've got my big screen TV. It's a good 40-inch TV up in front that's linked to my computer behind them. So that way, all the photos, all the X-rays, if I see something that's interesting, it can be put up right there, and it becomes almost a mini lecture. I'll say I'm kind of deputizing the patients into almost a dental degree. They need to know not all dentistry, but their mouth dentistry. And it really helps with, obviously, appreciation of what we do as a dentist on a daily basis, but also what's going on in their mouth. Maybe they've got stuff to do. Maybe it's totally pristine. But there's always things to talk about. I mean, in someone's mouth, whether it's a crazed line here or a little bit of recession over there. Maybe they're brushing too hard. Maybe they're grinding. And the different links between things. We look at, obviously head and neck, and we talk a lot about tonsils and obstructive sleep apnea, and then pediatric dentistry. It's a really wonderful, there's no one set conversation, which is why that's my favorite appointment. I love doing comprehensive exams because it's back and forth, just like we're doing here. I mean, there's no set script. There's no set, of course, there's bullet points you have to hit, but really it's just very honest conversation with a patient. And that's what makes 40 years of enjoyment between a doctor and a patient, I think.
Yeah, and I think that separate that new patient meeting the dentist first is
absolutely.
It just totally differentiates your practice as opposed to scheduling with a hygienist and just getting their cleaning and their prophy. And what's also funny is the number one reason new patients come into my office and left their last dentist, the number one reason in my office, and it's almost solid for 20 years. Well, I just wanted a regular cleaning. They said I needed a deep cleaning. So obviously they didn't earn the trust, the respect. Yeah. They didn't show them the X-rays. They didn't understand it. They didn't believe it. I just passed on an attorney because I was setting something up, and he couldn't explain it to me or my president. I mean, we listened to him for 1 hour, and then when he left, it's like, okay, do you understand wills? I don't. I mean, I'm not dumb, but I should be smart enough after 1 hour. I should understand a will for my 4 boys. You know what I mean? I didn't understand it.
I've been very blessed. I've got a patient Rolodex full of what I call high dental IQ patients, right? They're very smart, but they're not dentists. They're not in the dental field. They can get it. They absolutely understand what we're talking about because in the end, dentistry, whether it's fancy implant dentistry, like you said before, whether you're building like Carl Misch backwards to front, but it's still just building. It's construction. What's a post? It's like a piece of rebar. Lots of analogies. Intelligent patients can really get that because they want to. They want to be part of it. They don't want to just lay there and say, "Fix me, doc." That's not what the modern patient, I find, desires these days.
And I think a lot of people have heard the saying that journalists say all the time: explain it like you're explaining it to a 6th grader. And a lot of people sit there and say that comes off that, oh, well, that you mean explain like they're dumb. And it's not that they're dumb. It's like, I'm a dentist. I'm not a plumber. I'm not a mechanic. When I take my car into the shop, he has to explain to me like a 6th grader understanding of auto mechanics. I mean, I grew up playing Barbie dolls with 5 sisters. I never changed the oil, transmission. I don't know any of that stuff. And I play the music so loud, I never hear the engine warning signs or, just if the light comes on, I take it in there, and I need them to explain it to me, like a 6th grader. Well, Eric, you said you lecture sometimes at your study clubs and stuff.
Yeah, I have.
If you got an hour lecture, I'd give anything to have you put it up on Dental Town. You can.
I'd love to.
Yeah, I would absolutely love that because I just think you're a hell of a guy. You're a hell of a clinician. You're a hell of a social media. I just think you're a hell of a guy. And I just want to tell you, we're 2 minutes over time, but thank you so much for spending an hour with me today. I just think, and thank you for all you do for dentistry and your the CDS Foundation, the DuPage County Health. I mean, everything. You're just a hell of a guy. Thank you so much for spending an hour with me today.
It means a lot coming from a guy like you. You're just somebody that I've sat in your lectures and your MBA for dentistry courses and things, and it's just fantastic being able to sit here. This is exactly what I wanted to have when I was young. First year out, second year out, being able to rub elbows with somebody the likes of Howard Farran or the likes of anybody else in that league. I mean, really, we're talking A-list people here, and here I am sitting Skyping with you, and it's fantastic.
Thanks, buddy. Well, thanks, and I hope you have a rockin' hot rest of the day.
You too. Thank you very much.